When we're talking about persons who are domestic workers, we're not only talking about maids, which is the traditional understanding of the word domestic, but we're also talking about butlers, housemen, gardeners. Those persons who work intimately on the curtilage of the household would be considered domestics. Protecting domestics is a very important thing. As you said, they work intimately with the household. So there are a number of things that you want to be able to do to protect yourself as a domestic and as a householder who's bringing someone into your home to clean your house and so on, because it's a balancing act. So you want to, first thing, if as a domestic, if you are ill and you are feeling any of the symptoms of COVID-19, you've lost taste, smell, you are having a cough, you are having fever, you're having respiratory problems, or maybe you're having what Barbadians would call bad feels and general malaise, then it is better for you to stay home and call the Ministry of Health hotline, and they will be able to guide you accordingly. The converse is true. If you are, as an employer, you're bringing a domestic into your home and you're not feeling well, it is good for you to tell that domestic, well, hey, you know what? You stay away for a time until I can get myself sorted out, so that you don't have the disease being transferred from one person to another. And we've also said, if at any point in time that you are ill from COVID, then before you return to work, it is good to make sure that the doctors will give you a clean bill of health before you return to work. We don't want persons going to work and not feeling well, and because we know that things can be a bit tight sometimes, we've been shut down for a period of time, the temptation is sometimes to go into work because you need the money. But the best thing to do is to stay at home. If you're not feeling well, call the Ministry of Health and Wellness's hotline and they will guide you accordingly. Now, once the domestics are in the home, when you come into the home, the first thing you want to do, you want to make sure first you're wearing your mask. You wear the mask on the streets, you wear the mask into the home. When you get in, you want to wash your hands or sanitize the hands. Now, let's talk about wearing the mask first. Wearing the mask is recommended while working in the home where other people are in the home with you. So while you are working in the home and the householder is there, or maybe other domestic workers, or maybe someone who come to do some repairs or anything like that, once you are in the same room as that person, then you know at some point in time you're going to breach that 6 foot social distancing guideline. You want to be wearing your mask. There are some domestics who come into the home, the householder leaves the key for them, they come in and they do their work. If it's just you in there and you're not going to be with anyone, you don't need to be wearing the mask. The mask is only to help protect others from you and you from other persons. So in terms of the mask, that is the wearing of the mask. The masks are normally worn, we recommend a maximum of 4 hours per day. If it gets damp, then you might want to change it. But if you are in the home and you're not wearing it continuously, then it can stretch out a little longer. Okay? So once you've come into the home, it is recommended that you have a change of clothes. Or you may want to put on a covering or some sort of apron or something of that sort, because you want to be able to come to the home, change into your work clothes, and when you're leaving, change back into your home clothes. It may seem, I know a lot of people already do that, but it is a very good practice, because you want to be able that you can isolate and separate your workplace from your home. And one of the ways of doing that is by wearing an apron or smock, which is a covering that you see the nurses wear sometimes, or you can wear your own clothes, a change of clothes, sorry.